Danger in hurry. The communities in Obongi County in Moyo District are likely to be wiped out with hepatitis B strain disease if the government fails to run to their rescue with appropriate measures to curtail the skyrocketing spread of the disease. Dr. Richard Eranyo is the hospital in charge at Obongi Health Center 4. He tells me that so far they have lost scores of people to hepatitis B in Obongi County compared to other regions of the country. The rate of lives lost to hepatitis B is scary.
So we lost, in the last financial year, we lost 25 people, and out of that, 8 are cases of hepatitis B, chronic liver disease. So that's around 36% of the cases of hepatitis B.
Hepatitis B is often contained with immunization vaccines. However, in the case of Obongi, which is a hard-to-reach area, cut off with the Nile River, government has directed that health workers apply ARVs for HIV/AIDS patients on hepatitis B patients. Very shocking and traumatizing.
We usually use the same drug as HIV/AIDS patients. The ARVs which we use are the ones we use. For also hepatitis B, we use what we call tenofovir-based treatment. But again, that's another issue. The government has not put really procurement of drugs for these things. So we dig into the HIV treatment. We sell the drugs. Now that's where the issue comes in. We are told to order more so that we cover both hepatitis B and HIV.
I was interested in finding what was the basis of ARV's recommendation on hepatitis B patients.
Similar. However, hepatitis B takes a slower course. You may get it during childhood, but you can stay up to adulthood without having the issue. The only problem with hepatitis B is it only damages the liver. Now, the damage to the liver is not that acute. It is a chronic thing. It takes time. It takes time to manifest itself. So that is where you find HIV. If you don't intervene within 1 to 3 years, you may get complications. Hepatitis B, for it is silent. We call it silent killer. You may get it during childhood. It takes years before you realize that actually you had this and the damage is going on. That's why the problem comes.
Prior to the ARV's recommendation by Ministry of Health, what have been the preventive measures applied by health workers here at Obongi Health Center 4 on hepatitis B patients?
Hepatitis B, the main program we're doing here is that the first is to do the immunization. We give them the vaccines to prevent them from what? From acquiring this. That's the first thing we do. But of course, it is a sexually transmitted disease. So we also caution them on safe sex because, just like HIV, it is sexually transmitted. And then also there's another transmission, mother to child. So, in the routine immunization, we have a vaccine that protects this child from acquiring hepatitis B, and that is the pentavalent. We give them. So we tell the mothers, please bring these children for this immunization. Don't miss this program. So these ones are going to protect your child.
We are meant to understand that what worsened the hepatitis B disease situation in Obongi is that the people are not keen enough on their health, and the sanitary conditions here are in question. This not ruling out their strong beliefs in witchcraft. Many think that hepatitis B disease is as a result of witchcraft.
Yeah, the community here has a poor health-seeking behavior. They only seek for help when they have very bad symptoms, that's when they come to you. And two, they so much believe in traditional healing and then witchcraft issues. So by the time they come to you, they have failed other options, that's why they come to you. So you find they come late. Most of the people, the 8 people we lost last year because of hepatitis B, they came in a late stage where the liver is completely gone. And that's why we get the problem in.
While government seems to have put much emphasis on other immunizable diseases, in the case of Obongi, vaccine drugs for hepatitis B are hardly available, and ascertaining whether one is suffering from hepatitis B is always a challenge, since Obongi Health Center 4 has no ultrasound machines to do the tests.
The government have put a lot of effort on immunization. People who are found negative, they immunize you. But now the issue is the people who are positive, the ones who are positive. To start them on drug, we need to do a series of tests. One of the tests you need to do is the liver function tests. You need to do ultrasound. You need to do maybe the platelet count to determine whether you need to start this person on treatment or not. And most of these tests are not here. We usually, for the liver function test, we usually refer them to Moyo, but again, the Moyo Hospital. But the machine, the chemistry machine there is not working because of, I think, environmental issues, and also it's kept not working. So you find most of our patients are either referred to Arua to go and get the liver function test and bring it back. And then some of these tests, you bring them back and then you do what? You work on them.
While hepatitis B is a major threat to the community, malaria cases also remain a head-on collision challenge, riddling lives at Obongi.
We get 56% of our patients here are malaria cases. But again, as I said earlier, majority of them are hygiene related. We live in a poor community, the community is poor, and the standard of education also is a bit low. So we find issues of hygiene coming. In the last financial year, we had 2 outbreaks of cholera. So
we established that also the working conditions of health workers at Obongi also counts to the disease burden problem in Obongi, since many of them live a desperate life.
These staffs are disparate. They are disparate because, one, this is a hard-to-reach place. In some other places, if in town, someone works here for 8 hours as recommended by the government, then they get a free time to go and part-time in some other places. In Obongi, you cannot do it because you don't have clinics nearby. So the only thing you do is you wait for the salary to come. And when it delays, you become disparate. Sometimes you lose interest in work. So you find one staffs. That's why we cannot retain them around here because of that issue. They had to reach allowance they're not getting. And they look at their neighbor, Germany, they're getting it. And when you compare Germany to this place, you find this place is more hard to reach than Germany.
Timothy Sibasi, Vision in Moyo, Obongi County.